Good health and well-being is Goal 3 of Sustainable Development Goals, aims to ensure healthy life and promote well-being for all at all ages. Thus, the theme will focus on revolutionizing malaria battle. Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. Most cases of malaria do not result in life-threatening complications, but it is unclear what causes the infection to progress from uncomplicated to serious.
Next, I will talk about the real-life issues. Based on the Covaro 2009, the disease of malaria causes almost 881,000 deaths every year, which mostly happen in sub-Saharan Africa. Mostly malaria deaths are in children that are under 5 years old. By looking at WHO, in 2019 there will be 233 million cases, whereas in 2022 there will be 249 million malaria cases. Malaria can be spread through infected female Anopheles mosquito, blood transfusion, and contaminated needle. This can be seen as a very big issue, thus this disease can be solved by a certain solution and agency that is involved.
Malaria treatment currently relies on 3 days artemisinin-based combination therapy (ACT), but drug resistance has necessitated new treatments. To develop cost-effective drugs, a systematic approach should be employed in clinical phase 2 trials, starting with a 3-day regimen and gradually decreasing to a 1-day regimen. Multi-dose regimens of artemisinin class derivative show higher resilience against early vomiting compared to single-dose regimens. Thus, artemisinin-based combination therapy is the recommended first-line treatment for uncomplicated malaria. The primary use of ACT is to effectively and rapidly treat malaria infections caused by Plasmodium falciparum, which is the most deadly species of the malaria parasite.
ACT combines an artemisinin derivative, which rapidly reduces the number of parasites in the blood, with another anti-malaria drug that eliminates the remaining parasite. This dual action helps to achieve a faster and more effective clearance of the infection. The combination of drug in ACT helps minimize the risk of developing resistance to anti-malaria medication. This is crucial in the context of malaria, where resistance to drug has been a significant challenge. ACT not only treats the current infection but also reduces the likelihood of subsequent malaria infection, providing a more comprehensive approach to malaria management. In January 2022, the Ministry of Health Malaysia has been implementing artemisinin-based combination therapy (ACT) as a part of its malaria treatment strategy. ACT is recommended by the World Health Organization (WHO) as the first-line treatment for uncomplicated malaria caused by Plasmodium falciparum, one of the common malaria parasites in the region. In conclusion, malaria treatment has advanced significantly over the years, resulting in a decrease in the disease burden. However, challenges as a drug resistance and treatment access remain. The discovery of new anti-malaria drug and vaccine raises the prospect of malaria being controlled and eventually eradicated. Continued research and development investment is critical to meeting the goal and ensuring the malaria treatment remain effective for many years to come. It is critical to develop new drugs and/or vaccines that can significantly and constantly disrupt this complex parasite life cycle. Malaria vaccine development is currently moving forward, and this momentum must be maintained in the future.